Hi, my name is Allison, and this is my daughter Claire, who lives with Rett syndrome. Claire's starting to get a little sassy, and she's got a very determined personality. She wants to do what she wants to do when she wants to do it. We always say, Claire don't care. We live in New Jersey with my husband Brendan and her sister Anya. The first thing you need to know about Claire is she's a bucket of laughs. Claire likes her alone time and enjoys watching TV, scrolling through YouTube, and listening to music. She also likes to be active and bounce on trampolines, swim in the pool, and go to the beach. Today, Claire goes to a small school where she has a one-on-one aide. All of her activities are tailored to her abilities. She has occupational, physical, and speech therapy. Claire loves school. She hurries to the bus every morning to see her friends. Outside of school, Claire gets to do horse therapy or hippotherapy, and she takes swim lessons and gymnastics. Claire goes to a physiatrist who checks her muscle tone, screens for scoliosis, and checks on her foot and ankle strength. She wears special shoe inserts to correct for weak ankles and flat feet, and she wears a lift to help with a small leg length discrepancy. Claire sees her gastrointestinal doctor regularly for constipation, as well as a nutritionist. After Claire's Rett diagnosis, I called a Rett Center of Excellence and made an appointment. The center we went to was participating in the clinical trial, so that's where I first learned about DAYBUE. When we went to the doctor to talk about the trial, Claire was only 4 and she had to be 5 to join the trial. When Claire turned 5 in March of 21, we went that June and started the DAYBUE trial. Before starting DAYBUE, Claire's doctor told us about the possible side effects such as diarrhea. When Claire started DAYBUE, I actually stayed home with her for 4 days because I was waiting for her to experience diarrhea, but she never had it. Claire has been on DAYBUE for more than 2 years now. Her experience hasn't always been easy because of some side effects, but since starting DAYBUE, we have seen improvements in Claire's Rett symptoms. Before we started DAYBUE, Claire was really knotted up with her hands. She would grab her elbows and kind of grab her legs and be all like a pretzel. Since we started, her hands are more fluid and open. She's able to separate them for longer periods of time. She can grab a fork, she can grab a cup, and much to her delight, she can grab an ice cream cone. Claire loves snacks. If she's hungry, Claire will walk over to the fridge and tap on it to let me know. She even grabs chips off the counter and throws them right at me. Claire's eye gaze has improved too. She looks right at me, which is amazing, and she knows everyone in our family. She's using her eyes more to convey her feelings, needs, and wishes. Claire's also able to use her communication device to do more things. For example, at school, she can select her classmates' names on the tablet and walk over to them. At home, she can show me what she wants for a snack. Claire's hand usage has improved so much, we were able to switch from an eye gaze dependent device to now one that uses her hands more in hopes of increasing her communication skills. Claire's teachers have noticed a difference since starting DAYBUE. We learned that she can categorize items with visual aids. If the teachers show her a picture of a watermelon, a book, and a character from a movie, she knows which one belongs in the food group and tells us with her eyes or her hands. Claire's vocalizations have increased since starting DAYBUE. As I mentioned, she's getting sassier with age, and she likes to be heard. She's babbling more and screaming to let us know what she wants. But now we can tell the difference between her screams and what they mean. We know the difference between I'm annoyed, I'm mad, or I'm just screaming to be heard. Claire used to have hour-long tantrums, mostly at night. She would wake up in the middle of the night and cry for a long time. Since starting DAYBUE, we haven't had these as frequently. In fact, I can't remember the last time we had one. Since starting DAYBUE, we're able to experience a lot more as a family together. Before we started DAYBUE, we would go out to dinner and Claire would need her tablet and shows immediately. She would get agitated halfway through and be really upset. Now we go out for an hour and a half. She doesn't need anything to keep her entertained and she's able to engage with us at the dinner table. I think it's important to note that in addition to starting DAYBUE, Claire has grown up a lot over the past few years. She went from being almost 5 years old to over 8 years old, which is a big change. And as caregivers, Brenda and I have become better at anticipating her needs. There are a number of things that have changed our Rett experience over these past few years, and DAYBUE is a part of that journey. When we first started DAYBUE, we worked with Claire's doctors to learn all about potential side effects. Claire started at the recommended dose, but soon after started having some behavioral outbursts, anger and anxiety. She didn't want to eat or sleep, and it was very difficult to go out of the house. After talking with doctors, we lowered her dose and the mood changes disappeared. Each time we tried to increase her dose, her mood changed again and the behavioral outbursts came back. In consultation with her healthcare team, she's currently taking an adjusted tolerated dose, but we're working towards titrating up to the recommended dose. I wanted to share our story with DAYBUE because every child is unique. The more stories that are out there about DAYBUE, the more parents can make an informed decision for their child.
What are the possible side effects of DAYBUE? Diarrhea. Diarrhea is a common side effect of DAYBUE that can sometimes be severe. Diarrhea may cause you to lose too much water from your body, dehydration. Before starting treatment with DAYBUE, stop taking laxatives. Tell your healthcare provider if you have diarrhea while taking DAYBUE. Your healthcare provider may ask you to increase the amount you drink or take anti-diarrheal medicine as needed. Vomiting. Vomiting is a common side effect of DAYBUE. Sometimes vomit can get into your lungs, aspiration, which could cause an infection, aspiration pneumonia. Tell your healthcare provider if you have severe vomiting or if vomiting happens often. Weight loss. DAYBUE can cause weight loss. Tell your healthcare provider if you notice you are losing weight at any time during treatment with DAYBUE. The most common side effects of DAYBUE were diarrhea and vomiting. Other side effects include fever, seizure, anxiety, decreased appetite, tiredness, and the common cold. These are not all the possible side effects of DAYBUE. Tell your healthcare provider if you have any side effects that bother you or do not go away. What should I tell my healthcare provider before taking DAYBUE? Before taking DAYBUE, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant or plan to become pregnant. It is not known if DAYBUE will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if DAYBUE passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking DAYBUE. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking DAYBUE with certain medicines may affect how the other medicines work and can cause serious side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also call Acadia Pharmaceuticals Inc. at 1-844-4ACADIA, 1-844-422-2342. What is DAYBUE? DAYBUE is a prescription medicine used to treat Rett syndrome in adults and children 2 years of age and older. It is not known if DAYBUE is safe and effective in children under 2 years of age. DAYBUE is available as an oral solution, 200 milligrams per milliliter. The risk information provided here is not comprehensive. To learn more, talk with your healthcare provider and read the accompanying patient information. Visit daybue.com for the full prescribing information.